Hopefully, I think Jin is going to have some questions for me, and then Gina and Sophia are probably going to have some questions for Jin. They're probably going to be very similar questions.
I
So
see.
whatever Jin asks me, Jin is going to have to answer too, but for Korea.
Yeah, yeah,
Okay.
okay. Let's start.
All
So,
right.
hello, I'm Hyunjin Shin, a neuro-ophthalmologist in South Korea and a former fellow of Dr. Lee. I have always admired his ability to explain complex neuro-ophthalmology concepts in a very simple and memorable way. Through this interview, I hope Korean viewer can discover NODAL and feel that neuro-ophthalmology is not something to fear, but something they can understand step by step. Hey, Dr. Lee.
Hi, Jin.
Yeah, hi, and Sophia and Gina. Nice to meet you.
Nice to meet
Okay.
you.
Yeah,
Nice to
right.
meet you.
So, and we can let's start. So, Dr. Lee, thank you so much for joining us today. It's great honor to introduce you to Korean viewer. As many our audience member know, Korean neurosmology can feel difficult and intimidating at first, but your nodal channel has made complex topics much more accessible, memorable, and even enjoyable. Today, we would like to talk about you why you started NODA and what makes neurosmology so fascinating, how Korean viewer can benefit from your teaching. So, my first question is that what inspired you to start the NODA channel?
So nodal is neuro-ophthalmology with Dr. Andy Lee, and we envision it to be like a node. So a node is a connection point, as you know, and so we envision it from the start to be a nodal point of contact for people of different learning styles and different levels of expertise, beginner, intermediate, and expert, who could come together in a single place and very quickly in very short video format learn something about neuro-ophthalmology. So it's exactly what you said, Jen. We're trying to make it easy, accessible, entertaining, educational, and fun.
Oh, thank you so much for your, simple and very interesting answer. So, and this is a wonderful story, Dr. Lee. So, and my second question is that you have trained many fellow, including me, and also student like Gina and Sophia. And what made you think that Korea could be a good place to introduce the nodal?
Well, we definitely are trying to be more of a global brand and have a global presence. And what I've learned is sometimes it's better to have the messenger deliver the message in a way that's culturally appropriate, but also in the language of the people who are trying to learn something and making connections and friends, and of course, colleagues like yourself, Jin, in Korea who are like-minded. So we're trying to find like-minded people, not just across the globe, but in Asia and in Korea, and trying to find people who are interested in neuro-ophthalmology. And to your point, having a fellow like yourself, an international fellow, come from Seoul to Houston, allows us to share our love and our passion for neuro-ophthalmology with the world. And so we want to try and do this for Korean learners. And that's kind of why Gina and Sophia are on here. We have Korean American students, and they can speak Korean and they can understand the culture and they can help us put a face to our message. And I am not Korean, I'm Chinese, but we are trying to do the same thing in China and in Thailand. And so for me, it's exciting to get started with a Korean colleague, especially someone we know and trust, which is you, Jin.
Yeah, so great, Dr. Lee. So good to have many international fellow. Maybe Chow, you wanna charge with Thailand, no doubt. So I feel personally very honored, and so no doubt whiteboard style may fit very well with the Korean medical student environment. Thank you so much for your answering that. So my next question is that what makes neuro-ophthalmology so fascinating. So what makes, for Korean viewer who are not familiar with ophthalmology, how would you explain the charm of this field?
Yeah, I think one of the great things about neuro-ophthalmology is that it is the bridge between neurology and ophthalmology and neurosurgery, neuroscience in general, neuroradiology. And so for me, I think it doesn't matter whether you're trying to be a neuro-ophthalmologist or not, it has something for everyone. And so that inclusiveness is part of what I want to achieve with the channel. And that's kind of what we have envisioned for our global outreach is trying to make it accessible, make it easy, make it quick, make it accessible so that you won't be intimidated by neuro-ophthalmology when you see it in real patients or as a learner on the test.
Yeah, so you told me that neuroophthalmology is kind of a field of detective. Yeah, I completely agree. Neuroophthalmology often feel like a detective work, and we may not always see the lesion directly, but through the patient symptom, eye movement, visual field, and pupil, we can localize the problem. So you always told me that. So this is a train of thought. You're right. I
Yeah,
completely agree. Yeah,
I agree. I think that's kind of what part of our message is that there's structure and there's a system to neuro-ophthalmology, and that structure and system for being a detective and fleshing out the problem is part of the learning experience. So it's not just about neuro-ophthalmology, it's about how neuro-ophthalmology can be a system like a detective for being a better doctor.
yeah, right. I completely agree. I always teach my resident, this is a train of thought. That's what Dr. Andy Lee told me. So don't memorize train of thought. So amazing, message. So, and what should Korean viewer take away from NODAL after, watching NODAL? What do you hope Korean medical student, resident, and the ophthalmologist will feel?
Yeah, so one of the goals, in addition to being a more global presence, is learning from our different audiences. And so there are clearly diseases that look different in Korea that
Right.
than in America. And so the same disorder, for example, optic neuritis or ischemic optic neuropathy might look different to a Korean physician because your demographics, your population, your risk factors are different. So part of my goal for myself personally and professionally is I believe we can have as much to learn from you and from our Korean audience about disease as we have to teach. So one of the things we're trying to do is make it iterative, but also interactive so that the audience can ask us questions. Tell us about insert whatever they're interested in. And so I'm interested to hear from the Korean audience, what do you want to know about? What do you want to hear about? What is interesting to you? And part of our goal with NODAL is teaching, but also it's learning.
Wow, so great. So Dr. Lee, so many maybe Korean student and many resident email you, hey, Dr. Lee, we need this topic and we need to know about differences between Asian and Americans. So well, you're gonna be very busy.
So now you see what the second part of why Gina and Sophia are on here. Not only do we need messengers who are literate in the Korean language but understand the culture, but also can be at a peer to peer or peer to near peer levels so that these questions can come to us without anxiety or fear. And they will be helping us to screen these comments that are going to come in so that we can produce content that people are actually interested in, but also be accessible. I think it's just way easier for one medical student to talk to another medical student than it is for a medical student to talk to me directly. So I think you probably have that same experience, Jin. There's a hierarchy and maybe even more so in Korean culture than in America.
Yeah.
So we were trying to break down that hierarchy and allow it to be a flat hierarchy where people can feel comfortable asking questions that they might think are dumb, but there are no dumb questions. If someone has that question, then someone else probably is thinking the same thing.
Yeah, right. So Korea, we have a hierarchy culture. At the first time when I, so start my, fellowships, you always told me that we are all standing same front line, regardless you are resident, medical student, and staff and fellow. It doesn't matter. So we are all standing same front line, you know. Thank you so much for teaching that. So I love that phrase. You always told me, don't let the amygdala grab you. So many people become anxious when they heard the word in ophthalmology, but your teaching show that if we focus on fundamentals, even difficult topics can become understandable. Yeah.
No, for sure.
Wow.
I say that to myself too, Jin. I say, don't let amygdala grab you, which means fear is the mind killer. And I think that we have to respect disease, but I don't think we should fear it. We should understand disease. We should understand pathogenesis, mechanisms, uh, but fear is not something that I want to encourage. I want people to be brave and be bold and understand that we are fighting for patients and they feel confidence in our ability and we can't show them that fear. We have to show them respect, but our knowledge is our power and demonstrating that with confidence helps patients to fight disease and the reaper. So it's really important that doctors not let amygdala grab you, and it's even more important not to show the patient that you're afraid. Show them confidence, and that's what we're trying to do with Nodal. Bring knowledge as power to create confidence so that we can avoid uh, amygdala grabbing us.
Yeah, so thank you, Dr. Lee. So, and it's really, wonderful to talk to you like that. Amygdala review is very, memorable teaching for me. Do you have any message you'd like to share with especially young Korean medical student and young Korean ophthalmologist?
For sure, my message would be come visit us on Nodal and give us your ideas and ask us questions. And I think here at the end, maybe Gina and Sophia would have some questions for you because I think that what you've done in Korea in terms of your YouTube presence is part of what we're trying to do for ourselves. We're trying to have a synergy. And if we can do that in Seoul and in Houston, then we can have a bond. And that's what we're trying to create a relationship and an interactive node of communication. So, nodal for me is not just about neuroophthalmology, it's serving as a communication node that would be a point of friendship and interaction and professionalism between Korea and America. And so maybe I'll let Gina and Sophia ask you their questions and about how Nodal can bring our information to the Korean audience and maybe a little bit about what you think is unique about the Korean audience that we should know about.
Yeah. Wow, so great. But actually, Nodal is an English language. So how do you think Nodal content can be adapted for Korean viewer?
Yeah, so I think that there are clearly some differences in format and presentation in the Korean culture in terms of your social media presence. Our current platform and format is a whiteboard and just me starting to talk, but I think that there are probably some differences there that we'd like to leverage, but also learn about in terms of presentation, format, color, speed. It's clear to me that seeing your YouTube site that there's much more emphasis on the presentation and the introduction slide. You don't just launch directly into the whiteboard. You actually have a
Wow.
little bit of words there and in the Korean language. And so I think those are clearly some differences that are going to be a learning curve for us.
Yeah, so Dr. Lee, so whiteboard style is really, difficult. So I really, at the first time when I saw your YouTube in person, I really surprised because at the first time I listened to you practice in your home this concept and summarize every topic in 3 minutes. But you after our clinic, you told me, hey, so let's make a YouTube. What do you have any question like that? So wow, actually he didn't, practice at home. Wow, instantly, summarize every topic. Whiteboard is really difficult. So amazing. And so, uh, what, what are your hopes for the future of NODAL, especially in Asia? So actually, in Asia, neuro-ophthalmology is a little bit unfamiliar topic. Maybe you now already know that.
Yeah, I think we definitely want to reach the Asian audience, and Gina and Sophia are our producers on our side. So I don't know, Gina, maybe you could just kind of say what you think we're trying to do, and then Sophia could say it, and then we can kind of make it happen.
Yeah.
Well, I think that Dr. Lee pretty much summarized everything really well. But the main message of his Nodal channel is to reach audiences of all backgrounds, of all ages, and to make this a global experience for everybody to be able to share his knowledge in a fashion that's easy to understand, easy to digest, and easy to apply towards their own practices. That's the main goal, I believe, of Dr. Lee's to just connect everybody.
Yeah.
We all share the common experience of wanting to help others and help improve the lives of others. And if we can all play a part in making this a better experience for everybody, I think that's really the dream here.
Yeah.
Sophia?
Yeah, I think that was really well said. And I think a big part of kind of what Gina and I are hoping to do is making that bridge between the American audience and the Korean audience. Kind of like what Dr. Lee and Dr. Shin have said, there are some cultural differences in the ways that information is transmitted throughout audiences, whether that's medical students and residents versus the public. So I think kind of I'm thinking about those nuances when delivering our information and making different styles or different methods of communicating would be hopefully helpful. And then kind of talking more about the conditions that are more prevalent in Korea, maybe more enticing to our viewers in Korea.
Yeah. So
And
thank you
Gina,
for
I would just
wonderful.
add to that by saying that the other reason I need Gina and Sophia is because I think I'm good at like doing the whiteboard thing, but what I'm not good at is the technical aspects, understanding the audience and the generational differences, the timing. Like I could easily just give an hour lecture on something, and I know that this generation just doesn't have the bandwidth for it, they don't have the patience for it, and they will just turn it off. So I need a reality check and a recalibration from young people to tell me, this is on target. This is what a young person would watch. Or
Yeah.
the opposite. This is just too long. Or Dr. Lee, it's just too dry. You have to fix it. So I think Gina and Sophia on our end, Jin, are here to keep it real and make sure that I am meeting the needs of young people from a generational standpoint. And then the thing that I look to you for, Jin, is this is appropriate content from a scientific standpoint for a Korean audience from a medical side. So I think each of us on the team, and of course our producer, Sang, is going to be helping us on the production side. So we really we look to you as colleagues, and we're looking forward to this joint venture, and so excited to be able to participate.
Yeah, so thank you so much, Dr. Lee. So, producer Sangwon, so do you have any question and comment on this?
I thank you. I also saw the interview scripts that you sent through emails, and so another message that I found very meaningful is that you tell your fellows residents or medical students, saying that be a doctor first, an ophthalmologist second, and a cataract surgeon third. I think that was such a powerful philosophy that you mentioned. So it would be nice to explain more to the audience about um, your insights about the neuro-ophthalmology.
Yes, so
Yeah,
that's another facet of what we're doing is we try and be neuro-ophthalmologists is what we do, but we try and use general medicine concepts, pathology, anatomy, genetics, pathology, try to bring to bear all of the things that you learned in medical school we believe those are important things. And so that's what I mean by being a doctor first. But it also means talking to the patient, understanding them as a person, a holistic approach to the problem, but also to the patient as a person. So when I say doctor first, that's what I mean. And ophthalmologist second to me means bringing to bear the ophthalmology tools, our OCT and slit lamp and all our toys. And then the last part is just being the cataract surgeon because sometimes it's not a cataract. So I think that message for me is part of the overarching philosophy, not just for neuro-ophthalmology, but for our channel.
Yeah.
Nice. Well, I mean, I think it's a great content because also in Korea, neuro-ophthalmology is very, very special field. So we're very thankful for Dr. Shin to let us know about what the neuro-ophthalmology is in Korea too. So yeah, I mean, thank you so much for sharing your insights today.
Yeah.
You're
Do you guys ever
welcome.
consider about doing shorts instead of doing a 3-minute video?
So yeah, this is what we're looking to you for content and formatting ideas because we're used to doing it in a certain way with the whiteboard, but I am
Mhm.
totally open to new formats. And if you think, look, the Korean audience likes this format better, then we'll try and adapt. So
I
that's what
see.
we'd be looking to you for ideas because we don't know what we don't know. Um,
Mhm.
and the other piece of it is inspiring young people like yourself to want to do this. And certainly Jin has been an excellent messenger, and I'm sure that he has inspired many Korean young people in and his own way. So we're trying to create brand ambassadors, not just for neuro-ophthalmology, but for the whole idea of this teaching style and our philosophy, and we'd like to spread that message. And so the more ambassadors that we can create, the more people who are engaged and interested. That is part of the goal. Is I want to make more gins.
So thank you so much, Dr. Lee, for your kind words. You are a great mentor and teacher and even awakener. So you awaken me. And I'm your academic son, Dr. Lee. I always remind you your message. Remember us, make us proud, pay it forward. Thank you for teaching me like that. So today's conversation reminds us that your ophthalmology does not have to be intimidating. So with clear teaching, strong fundamentals, and visual learning, even complex topics become accessible. So I'm very excited to introduce NODAL to Korean viewer, and I hope this will be the beginning of meaningful educational collaboration between NODAL and Korea. And lastly, as a former fellow, it is personally very honored and meaningful for me to introduce your teaching to Korean medical student and resident. Thank you for your time, Dr. Lee, and your mentorship and your passion for education.
Well, thanks for having me, Jin. And the real thanks is going to be paying it forward. So I hope this collaboration will be fruitful and that we can bring it to the Korean audience and pay it forward.
Sure. Yeah, sure. So Gina and Sophia, any other comment or any other uh, things you'd like to send Korean viewer and medical student as well?
No, thank you so much for having us here, Dr. Lee and Dr. Shin. And we're really looking forward to the project and getting to work with both the American and Korean audience. So I'm really excited.
Yeah.
Thanks so much, Jin. I will send you the recording.
Yeah, thank you so much, Dr. Lee. So, and if you sending me and someone's recording version, so we're gonna make some, Korean fascinating version of YouTube. And so I hope you have a nice holiday and congratulations, Virginia's graduation. So I hope
Oh,
it's
congrats.
Thank you so much. And thank you so much for what you're doing with us. Gina and Sophia will be in contact, I'm sure.
yeah.